So this is my genetic disorder presentation. So the name of the disorder is Edwards syndrome, but it's also known as trisomy 18. So what is this disorder? So it is a genetic disorder, and it results in a child having undeveloped features and life-threatening problems. So what are the symptoms of a person having Edwards syndrome, generally an infant? So there is low birth weight, a small abnormally shaped head, a small jaw and mouth, long fingers that overlap with undeveloped thumbs and clenched fists, low set ears, smooth feet with rounded soles, a cleft lip and palate, and exomphalos, where the intestines are held in a sac outside the tummy. So babies that are born with Edwards syndrome also experience certain types of problems, such as heart and kidney problems, feeding problems, which could eventually lead to poor growth, breathing problems, hernias in the wall of their stomach, bone abnormalities, such as a curved spine, frequent infections in the lungs and urinary system, and a severe learning disability. So what causes Edwards syndrome? So the genetic cause is chromosome mutation. So it's caused by a trisomy. A trisomy is when instead of having two copies of a certain chromosome, there are three. So in Edwards syndrome, there is a trisomy in chromosome 18. So that means there's three copies of chromosome 18 instead of the normal two copies. How is Edwards syndrome inherited? So it's very rare that it would be inherited genetically, but most of the time it is a random mutation that occurs during the formation of a sperm cell or an egg cell. So this just represents the spontaneous and random mutation. How common is Edwards syndrome? So Edwards syndrome is common among infants. So generally infants. So the prevalence of the disorder. So infants are normally affected by this disorder as it develops when the fetus is in the womb. It's also three times more common in female infants than male infants. And the incidence is the disorder occurs in 1 to 5,000 infants, but normally the disorder develops while the woman is pregnant. The chance of having a baby with Edwards syndrome gets higher as the woman gets older. So how is the disorder diagnosed? So why would someone get tested for Edwards syndrome? So normally women who have been pregnant for 10 to 14 weeks are eligible for a screening for Edwards syndrome to predict the chances of the infant having the genetic disorder. And when is it tested? So this is tested when the woman is pregnant with the infant. It's normally 10 to 14 weeks, but it also can be further along. It can also be tested when the child is born. So how is it tested for, and what tests are used, and what does it show or look for? So during pregnancy, there's a blood test and a special ultrasound done, known as a combined test. This helps figure out whether your child has a higher risk of Edwards syndrome and other genetic disorders. This test involves taking a sample of the baby cells in order to check to see if they have an extra copy of chromosome 18. So there are two ways of getting the samples of the cells. One is called chorionic villus sampling, which collects the sample from the placenta, while the other is called amniocentesis, which collects the sample from the amnio fluid that surrounds the baby. When the pregnancy reaches 18 to 21 weeks, the woman is allowed to have another scan, so this is known as the mid-pregnancy scan, to see if there's any physical abnormalities with the baby. There is another test that has been recently developed that can be performed by taking a sample of the blood for the mother at 10 to 12 weeks and testing the baby's DNA that is found in the sample. This test is known as non-invasive prenatal testing and is only available privately. It can also be tested after birth, so if the doctors believe that the baby has Edwards syndrome, they can take a sample of the baby's blood and check to see if there's an extra copy of chromosome 18. So what treatments are available? So there are several treatments for Edwards syndrome. Most of them focus on the life-threatening aspects of the disorder, like the infections and heart problems. In addition, the child will have to be fed through a feeding tube since the child will have feeding problems. As the child gets older and they develop limb abnormalities, they can go to supportive treatments such as physiotherapy and occupational therapy. In addition, the woman is given the choice to terminate the pregnancy if they believe that's the best possible choice. And normally you can be offered counseling as well for the woman, but otherwise this is just more focused on the infants. What is the prognosis of Edwards syndrome? So the life expectancy is very short. Usually if the disorder develops during pregnancy, the mother can miscarry in the second or in the third trimester. When the baby is born, it can also be stillborn. Even when born, a child with Edwards syndrome can barely survive for a year. The average lifespan of an infant born with Edwards syndrome is 3 days to 2 weeks. The percentage of a child living to about a year is very low. It's like 5%. And then pretty much as the lifespan gets longer and longer, the percentage becomes lower. So is there any current research being done to find the cure? Currently, there's no research being done because of the spontaneous mutation, and it wouldn't be easy to track down when the mutation would happen. So that's my presentation. Thank you for listening.